Approval of minutes from the April 7th.
So moved.
Second.
We have a motion and a second. Any more discussion? All in favor, say aye.
Aye.
You should abstain.
Or abstain, I was not here.
Yep, no problem. Item number 1, approve Carroll County Resolution 2025-011, approving county attorney appointment. This appointment will last until after the November 9th meeting when we canvass the 2026 general election. So the resolution reads, be it resolved, the Board of Supervisors of Carroll County, Iowa in regular session assembled on this 14th day of April 2025 to approve the appointment of Kurt Steigert to the position of county attorney effective April 14th, 2025 per Iowa Code Chapter 69.14A subsection 2A1 until the next pending election as defined in Code Chapter 69.12.
So moved.
Second.
You have a motion and a second. Courtney, roll call?
Yes.
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 Item number 2, oath of office. If you guys want to come up. I can stand up here maybe and we can get out of the way in case someone wants to take a picture. Sure.
Kind of, Gina, it looks good with the flags in the back. If somebody wants to grab a picture.
That's it.
Yep. You guys let me know when you're ready. Good, okay. All right, please repeat after me. I do solemnly swear
I do solemnly swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of Iowa,
and the Constitution of the State of Iowa,
and that I will faithfully and impartially,
and that I will faithfully and impartially,
to the best of my ability,
to the best of my ability,
discharge all the duties
discharge all the duties
of the office in Carroll County
of the office in Carroll County
as now or hereafter required by law.
as now or hereafter required by law. Thank you.
Congratulations.
Thank you.
Congratulations.
Thank you.
Thanks.
No, you're good. Well, quick slide by.
Does he have to sign that yet?
No.
Okay, item number 3. Approve Carroll County Resolution 2025-012, appointment of Assistant County Attorney. And this resolution says, whereas Carroll County Attorney was appointed on April 14th, 2025, took the oath of office on April 14th, 2025, until the next pending election as defined by chapter code. Whereas per 331-903, section 1 of the Code of Iowa, each officer may appoint one or more deputies, assistants, or clerks whose acts as principal officer is responsible, and approval of each appointment shall be adopted by resolution recorded in the minutes of the board. Now, therefore, be it resolved by the Carroll County Board of Supervisors that the following appointments by the attorney are approved. Aaron Aronson, Assistant County Attorney. So I'm looking for a motion to approve.
A motion to
resolution.
approve Aaron as Assistant County Attorney.
I'll second that.
We have a motion and a second. Any discussion? Courtney, roll call?
Yes.
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 Yes. You throwing us off there, Courtney.
Throwing a curveball. I like it. Item number 4 is public hearing, which is supposed to start at 9 o'clock. I think we should probably wait unless we want to skip down to payables, maybe.
You could do the plat for Dale.
Okay. We'll move down to item number 7, approved plat requested and owned by Dale Schlichty on Granite Avenue near 290th.
So moved.
Second.
We have a motion and a second to approve the plat. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. We want to move to payables. We've got 4.5, 5 minutes.
Yeah,
Let's go to item number 9. We have payables in the amount, actually for 3 weeks. $346,741.75. Anybody have any questions? I know there were some earlier.
I think I got them all answered.
yeah, I'm fine. I'll make a motion if nobody else. Approve the payables.
I'll second.
We have a motion and a second to approve the payables of $346,000.
Let's back up.
Yep.
I don't want to make that motion. That's why my name is on that list.
No, I can make the motion to approve the payable for $346,741.75.
Yep, and I'll second again.
Okay, we have a new motion, same second. All in favor, please say aye.
Aye.
Opposed? Bills are paid. So we can wait for.
Can you do that number 4-5 beforehand?
There, it kind of has to come, I think, after the public hearing. Because 5 and 6 are tied together.
3 minutes.
Thank you, Courtney. We'll skip to item 14, manure management updates. Weedron Incorporated, Section 30, Sheridan Township, 4-year plan. N&M Farms, Section 3, Washington Township, no changes. Row Pork LLC, Section 33, Eden Township, no changes. Gene, you want to do your committee reports? Can you do them in 2 minutes?
I can do a committee report. It's real short and sweet. The last week I had Tuesday was CCGP. Basically, we had a presentation by Pig Easy of Templeton. And this week I have a federal review at 10 o'clock this morning. And then this afternoon I have Region 12 open house, and then Thursday I will have CCGP executive board meeting. That's my week.
I can go real quick. Last week I had Region 12, we did receive the final audit. If you guys want to take a look at these, I'll hand these in to Courtney. Everything went well. We did have a new company do the audit this last year. It'll be interesting. We do have a 3-year contract with them, so the price won't go up, but I bet you after the end of the first 3 years, it will go up. If you want to take a look.
Was it a little more in depth than they had anticipated?
Yes, so yeah, we had our executive board and then we went into a policy meeting after that. I don't really have anything to report on that. Everything's kind of going well. We changed a few things on the housing loans, but other than that, it's fine. I'll hand those around. And then I also had, or this week I have newspaper radio.
We have the second resolution coming around for the appointment of.
Yeah, there was just a chair on that one.
Did you want to look at that?
I was there, yeah.
That you can look at.
I have it already.
It's your back there.
Okay, it's 9 o'clock. I'll open the public hearing. We'll move on to, I back up, 9 o'clock. Item number 4, public hearing for fiscal year 26 county budget and certification of taxes. And I can round numbers and go real quick, Courtney, unless you want to do it all.
Few calculations.
Okay.
We can go over that. We didn't receive any written comments on the budget. Gonna just point out a couple things, for fiscal 26. Our tax asking is less, by about $112,850. That's a good thing. Our expenses did increase, $655,123. And our revenues, not including taxes, so just our revenues increased $407,177. Just a few things that I noticed in the budget.
Is there any public comment from any of those in attendance? Any board members have comments they would like to express?
I would like to thank Courtney for her work, and I think all the department heads for what they've done. You know, we're very fortunate in Carroll County, and again, as if you look according to some listings, Carroll County, according to last year's budget, was on the bottom of the 12th from the bottom on taxes in the state of Iowa. And I think we've been very cognizant of people's tax askings, and we've done it. I think everybody's done a great job, and I want to thank everybody. Thank you.
I would agree with everything. I would echo everything Gene just said.
Yep.
Anybody else?
No, thanks, Courtney.
Thanks,
I've
Courtney.
learned a lot this year from you, so.
If there's no further comments, I will close the public hearing at 9:02. Item number 5, approve resolution 2025-013 elected officials salaries. So the new salaries will be for fiscal year 26. Instead of reading the whole thing, Courtney, I'm just gonna go read the salaries. Auditor will be $95,826. County attorney will be $97,789. Recorder will be $81,874. Sheriff will be $124,979. Supervisors will remain the same at $37,247. And the treasurer will be $84,886. So I'm looking for a motion to approve resolution 2025-013 for the salaries of the elected officials.
Make a motion to approve them.
I'll second that.
We have a motion and a second. Any more discussion? If not, roll call, please, Courtney.
Yes.
No.
Thompson,
Yes.
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 Thank you. Item number 6, approve resolution 2025-014, adoption of fiscal year 26 county budget and certification of taxes.
So moved.
I'll second.
So this includes the budget we just said and all the elected official salaries. We have a motion and a second. Is there any discussion amongst the board?
Just want to make it clear, I'm impressed with our board this year as far as the budget. The only reason why I am not in favor is the salary increases.
Okay. Anybody else? Any further comment? Roll call, please, Courtney.
Yes.
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 No.
Yes.
Thank you. Item 8 was deleted. We will move on to passport update, item number 10. Carrie, good timing.
Morning, Carrie.
Morning. That's not
And
good.
that microphone might need to be turned on.
Hold it down. Yeah, hold it.
Just hold it down. There you
There
go.
you go. That should be on. Yep.
Okay. We took over mid-August, roughly. There were 634 passports issued in 2023. Between the time we took it over to the end of 2024, we did 516 passports. So currently for 2025, we've done 145. That the 145 is just passports issued. That doesn't include the 323 people we've assisted in one way or another, whether it be phone calls or renewals, which we don't actually get anything from unless we have their photo that we've taken. We've taken 155 photos at $15 a photo. So for 2024, obviously, we were behind 2023, but there's no rhyme or reason to passports. It's just who's getting them this year, who wants them this year, who's lucky enough to get to go somewhere this year.
How many of, what percent are by appointment versus walk-in?
We really encourage the appointment because of all the other things that we do. Now, obviously, January, February, March for environmental health are not as busy. I can't really, maybe 75% to 25% walk-ins. Most of the people, when they call, we tell them, please make an appointment when you want to come in, but there's inevitably always people that are gonna walk in. Therefore, there are going to be people who we are going to miss because they've walked in without making an appointment. But
How
if they-
far of draw? Do you get people from Crawford County or Hudson County or
yes.
Greene County?
I don't know about Greene County so much. We've had a couple that have come from other states because other states, it takes so long to get a passport appointment, but they have family here. So they'll come up here. Like we had a kid who's actually lives in Houston, but his dad is here. And he came up here to visit dad and came in and got a passport because the wait time in these larger areas is so much slower than it is with us. I mean, we could literally, if somebody calls us, we could probably get them in the same day. Whereas these other cities are putting them off by weeks.
Sure.
So anyway, I think it's going well. Again, we've had to move, so there are some people that end up over here first and then end up over there, but eventually we'll get them figured out. But
I'm glad it's the service we can still offer.
Yep.
Yeah.
Thank you for.
any other
all you do
questions
on-
about?
I don't know.
So, thank you.
Do you want me to come back quarterly? Does that work or?
I think at least twice a year, but it's up.
Okay.
It's your schedule. Quarterly is fine with me.
Well, it's a very short, like, what the numbers are, so. Trying to put us in there when you're talking about budgets, it's like, yeah, they got enough to worry about with budgets, I don't. Come in and just throw some more numbers at them. So,
Thank you.
okay,
Yeah,
Thank you.
thank you.
Item number 11, public health opioid discussion.
You leave that on.
There way to share my screen, if not, no big deal.
There, if Dalton was here, you could,
That's okay. I emailed you all a PDF. of
Yes.
What I'm just gonna discuss.
Okay.
I was gonna show you was this on?
it's on.
Okay. I was gonna just pull up the websites, but the websites are linked on the document I sent you. So if you'll just, go through and look at them at your own time, or if you've got them in front of you, that'd be great. So what I wanted to discuss with the opioid settlement funds is just an option for what we can do with them. I don't want the money at all, so please don't think that. It's just an option for how we can best expand our reach rather than just giving it to one organization. Sorry.
What I gathered from our phone call was
Yep.
you were going to share best practices perhaps of 3 counties in our neighborhood that you researched where
Yep.
Several counties have given all of their money to public health
Mhm.
and the Board of Supervisors have been hands off.
Yeah.
Basically, other than they have to approve where the funds go.
Absolutely. And while that's been very great for some counties, I am a department of 1 full-time staff and 2 part-time, and I just don't have the capacity to handle it all myself. However, I would love to be involved and I'd love to, help spearhead some sort of effort. It just can't be all on me. I'm just one person. And so, yeah, like Scott said, this is what I have found in talking with other counties around us that has been really successful and has helped broaden their reach and distribute these funds to a broad variety of entities, groups, individuals. So this sort of strategy started with Jasper County. And their website is linked there. What they did was they formed a committee and opened an application, and the application is very user-friendly, I'll say. It's very non-intimidating, so it really does promote people to apply just because it's not a very intense application, which I appreciated. You'll see their committee members included their auditor, deputy auditor, Becky Pryor, who is their public health administrator, and one board of supervisor, as well as their county attorney. Now, I will say their county attorney, Scott Nicholson, he has offered to mentor and provide guidance to any other county that's wanting to implement something similar. He's very passionate about this. So that would be a good resource for us if, you decide to go this route.
Go above that, though. I liked where their priorities and goals, their target was school-aged children.
Yep. Yeah, and you'll see the priorities and goals between the counties I'll show you. They're very similar, but with some variation in there. And you'll see they've gone through 3 rounds. They're on their 4th round of funding, and they listed, where these funds went to, how much. So I just thought it's a good program just to kind of base off of. They do ask for, once funds are awarded, a quarterly report. And that report does need to include an itemized bill. And those are sent to the auditors, and the auditors keep track of that. The application itself goes to the public health administrator, who saves those and then brings them to the committee to be voted on. Now, the committee doesn't make the final decision of where these funds are going. That remains with the supervisors, but they do provide a recommendation. Now, with Dallas County, that's the second county I found that implemented something very similar. Again, similar priorities and goals. What I liked about their committee versus Jasper County is that it was more robust. First
And
off,
just the members on it are, I
Yes.
mean, they've reached out to every part of the community.
and the second part, aside from it being just a well-rounded committee, is that it lists a representative. So a representative from the Dallas County Attorney's Office. The gentleman listed, he's not the county attorney, he's the assistant county attorney. The second, a representative from the sheriff's office. Now, that man listed is the sheriff, but it doesn't have to be the sheriff. So whomever is passionate about it from those departments can join. Another part that I really valued here was a representative of community education, representative of pharmacy, which I think is very important, a representative with lived experience, and a representative of someone who works with people recovering from addiction with opioid. To me, it's just a very
Yeah,
diverse.
The EMS was in there too, which is,
EMS is in there as well, yes. As well as public health. So I thought their committee was a little bit more well-rounded than Jasper County, but still achieving the same goals, Now, their application is the exact same as Jasper County, just replacing Jasper with Dallas in the wording. Now, their funding is quarterly as well. And they are requiring a quarterly report from all awardees that must detail the total amounts of funding spent in that quarter, how those funds were utilized, and the number of residents that have been served. Now, they just implemented this, so we aren't able to see who they've awarded it to yet, but that will be announced here at the end of the summer, end of September. And you'll be able to see their application, the sample agreement for funding. Yeah, and now Greene County, while the same model as Dallas and Jasper, is just not as intense and as detailed, I'll say.
looks like maybe they're just getting started.
Yes, so they are on a yearly funding cycle, which a little bit different than the other two at quarterly. And then they require the progress reports every year by January 1st. They don't detail who is on their committee and publicly, which, I mean, you're not required to, so they've just chosen not to. And they haven't listed any publicly listed any awardees yet. Yeah, I just, I think we would be able to broaden our reach, and those we can help with this type of scenario. Now, the entities that we know are applying for these fundings would likely still apply with this and be awarded a portion of these funds as well. But I would hate to say, let's just give it to one or two entities and not know that there's a health educator in one of our schools that wants to implement some sort of opioid education for their students, or somebody needing treatment that doesn't have access to funding. So that's just my opinion. Take it for what you will. But
I think these are some best practices, the
Yes,
three
sure.
counties that are doing, I mean, we're sitting on roughly 300,000 that we, Taya's back there, she's getting ready to present, and she would probably be, if we were to form a committee, would be one of the committees receiving some of the funds.
yeah,
I like how Dallas
Yeah.
County did that committee members.
With the
That was smart.
pharmacist on
Yeah.
there
Yeah.
and
There's a lot of-
especially a
good
representative with lived experiences.
Yes.
I mean, they've got, yeah, I mean, that's, and again, I like,
And
yeah.
a person working for them.
I think they've got a perfect,
Committee members is
Yes.
great.
and
yeah, because it's been
EMS.
done in so many well, these are the three counties that I found. I'm sure it's being done in other counties because, like I said, the Jasper County Attorney has been working and mentoring other counties. So I'm sure there are others that will pop up, but a lot of the work has already been done for us in figuring out what works, what doesn't work, different policies and ordinances that they may have had to have implemented. So
we've had
is
our
it gonna be
funds-
no work? No, there's gonna be a lot of front end work. One thing that I did notice with their websites and where they listed the applications, most counties did create their own opioid settlement fund page on their website. Do you have to do that? No, it could be listed under public health. It could be listed anywhere on the website. So there would be some back end work there with posting it to the website and doing some, media and just public outreach to let people know that we're accepting applications. But once it's up and going, it's really more just accepting and reviewing those applications and providing a recommendation to you all and awarding those funds. So I'm not to say there's going to be no work, but to me, doesn't look too taxing.
Because I don't think all five of us who are technically in charge of awarding the funds have the expertise that having a committee like this would have.
And I'm not either. I don't want to be in
No,
charge. I'm
I'm
not an
signing, yeah.
opioid expert. But I think if we formed, the right committee and brought in the right experts, we could really broaden our reach with this. So,
And have success.
and have success, yes.
Yeah, make sure it's going to the right people. You don't want to just say, hey,
No.
we'll give these guys some money and this person will do a better job than that
Yeah.
person would.
Yeah, and I do like having the quarterly reporting and we
Mhm.
can see exactly how many people are being affected with the funding and being helped with the funding and where it's exactly going by asking for a quarterly budget and a quarterly report.
We have
And making
two
sure
in our,
our funds are being utilized properly.
Exactly,
Yes.
And there is also positive outcomes.
exactly. So,
well, thank you. I
yep,
appreciate
you're
it.
welcome. If there's any questions,
No, I
any of them
appreciate
to the best of
dialogue
my
we had
ability, or I can
last
reach out
week.
to one of the counties.
Thank
So,
you very much.
yeah,
Thank you
you're
so much.
welcome.
I
Yep.
appreciate it.
All right,
Yep, have a good day.
thank you.
You too.
You'll probably be hearing from us. All right, staying on opioids, item number 12, Manning Recovery Center opioid presentation. Taya Vanami from the Recovery Center at Manning Regional Healthcare is here. Good morning, Taya.
Supervisor? Good morning.
Morning.
Do you know everybody? We got a new member since we met.
I do not.
Newbie, Mark McCray.
Nice to meet you.
Nice to meet you.
My name is Taya. I'm a nurse practitioner around the Recovery Center at Manning. So glad to have you. First off, I have to say the presentation for me is probably the best presentation I've heard in all the counties I've presented at, and love her ideas. Some of the things down at Manning that we've worked on and kind of always looking for more funding and stuff is options. I know last time we talked, prevention was an area that we have been working on improving and increasing and offering education to various entities, not only the school age, but adults, communities, parents, different things like that, which we have continued to work on and add to our program. In addition, some of the other areas that we've increased the last couple of years and are always looking for funding in general are training for staff, especially in trauma-focused care and adolescents. We've seen an increase of adolescents patients in our facility, as well as I'm sure other places around us have. So keeping my staff trained in how to handle adolescent patients versus adult patients has been a priority as well. I did send an RFP, I know it's been old, back in 2023, that kind of outlined some of our prevention goals and aspects. And I know some of the other people in the county have talked about doing that as well. I think most of that was kind of put on hold depending on where things went and traveled, but that did at one point talk about putting a board or advisory committee together on some of this stuff, which I believe they just talked about again. So that's kind of where we have left it at Manning, just places, a lot of the stuff I presented, we've started with, we're moving on. Another aspect, we are seeing an increase of patients being uninsured. Something that the county could look at is somebody in our county needing treatment, not having the funding for it, if that'd be something they could apply for with the county for funds. Currently, I don't think there is anything in the county that somebody could get funding for treatment, whether that's residential or outpatient. But that would be another option if it was focused on somebody in our county not being able to pay for treatment. We do work with other private entities for patients to come to our facility for treatment that are paid for. Those are just kind of a couple of things we are looking at, a little broad spectrum.
So when we talked last time, I think you were already in some schools in Carroll County.
Mhm.
Are you still in those schools?
Some, yep, we have done some presentations in Carroll and Glidden and IKM Manning in Carroll County that are
And-
addiction focused.
And Crawford County supports you currently right now?
Absolutely, yes, we do a lot with Crawford County. And
From
we,
Crawford County opioid. funds I'm
yes,
talking
and
about
we
here.
did have some funding through Shelby County as well.
Okay.
So what does it cost for someone that doesn't have insurance?
To go to, so for a 30-day program, we typically do discounts for cash. It's still about $20,000 for a 30-day treatment.
The insurance doesn't cover any of that stuff on a lot of those.
Lots of insurances do, yes.
they?
Yep, no, lots of
But-
insurance companies do. Typically, those are the patients that fall in that window of make too much for Medicaid, but can't afford private insurance, or their job doesn't offer it.
What's your reimbursement from Medicaid for a $20,000 bill? What do you get?
That is a very good question. So Manning, actually, my CFO is fabulous and worked out some private contracts. So we actually do receive a little bit more than the state's fee schedule.
Okay.
With the current Medicaid, the 3 MCOs. I'm sure they're not gonna let us get away with that again, and we'll go to the fee schedule. So I apologize, I don't actually know what the fee schedule is, because we do get reimbursed a little bit higher than that with Medicaid patients, which is why.
Over 50%? Right around the 50% mark?
I think we're higher than that, actually.
They're 20,000 on cash, so it's probably
It's probably-
30 sent in for insurance.
Oh, yeah, I think we bill around 30,000. I know we don't
See,
get reimbursed
yeah.
that, but yes, 100%. That's,
So I'm just wondering if they get 50%.
we bill $1,000 a day even, is what we bill to insurance companies. I think our Medicaid reimbursement is between 65 and 70%. Currently, which is very good.
Yes.
I was gonna say,
We can, yeah, no, that is very good compared to the, it was under $200 a day. Before we negotiated those MCO prices. I shouldn't say we, I did not do anything with that. That is negotiation stuff, but we do currently cannot complain about Medicaid reimbursements. We serve about 65% Medicaid population. We're one of, there are not a whole lot of facilities left in Iowa that take Medicaid. There are definitely some out there. We are one of, I want to say 3, do not quote me on that take Medicare. So we also do work with Medicare. There are not many facilities that work with Medicare either.
How many do you turn away because they can't afford it?
A lot.
Is there, I mean, 100, 250, I mean, any
No.
idea? I'm just thinking how much more money we, if you're
Well, there's also a waiting.
waiting.
There's a wait list, but that varies. So last month I had 120 applications. And I would say close to 50% were turned away due to financial reasons.
No kidding.
But that's your total population.
That's statewide.
What
it's statewide.
what percent would
That's
that be?
statewide.
Okay.
the County.
I apologize, I don't know that answer. I couldn't,
You
I
gotta
could.
remember,
That's,
there's,
yeah,
Yes.
that's-
there's
We
several
do-
more than just
We
Carroll
do
County.
track, yes, we serve all 99
okay.
states, so that is statewide. I can tell you
Okay.
statewide numbers. I'd have to specifically look. One of the hard things that I've seen with people is not everybody wants to go to treatment where they live.
Mhm.
Yeah.
Not everybody is ready, that can be uncomfortable, and I absolutely understand that. So we do serve people in Carroll County routinely, but not as much as what we serve Polk and Pottawatomie County. The bigger counties, obviously, they have a larger population, plus people tend to want to go where they don't live for treatment. That is not always the case. We do have a very large AA and NA community in Manning and in Carroll County in general, to help serve our population. And those are a lot of times people who've gone through treatment in local facilities, whether that's outpatient at New Op or Manning or residential at Manning. So we do still serve our county, but those are monthly numbers and they do change month to month. There are times we go 6 to 8 weeks with a wait list, and there are times that I can get people in the next day. It varies all the time.
What are the percentage of court ordered appointments for opioid? Not for alcohol, but for opioids.
Probably close to 50% of our
Okay.
patients are court ordered. And at least half of that is alcohol. I would say alcohol and methamphetamines are our two biggest substances that we treat. And that is definitely local as well. We do work a lot with the sheriff's office here in Carroll County. More than any of us want to work together. So they have to take the brunt of all 99 counties. So anytime somebody from another county has papers that serve, they're sent to Carroll County and the Carroll County Sheriff's Office brings them down to us. So we do work a lot with the sheriff's office, and which is pretty easy, thankfully, because we built that relationship to make that happen. So we have a lot of court ordered patients, whether that's willingly or not willingly, to come to treatment. So it's if you look at the CDC now, that a lot of the population's opioid overdose is now the #1 cause of death. Versus it used to be trauma or falls, which are traumas in our older population, is now listed as the opioid overdoses in some of the age levels that we're watching and seeing and stuff like that. So I think Carroll County is very blessed with the resources that we have and the finances that are there available. And I do really like the idea of it not going to one facility, that the aspect of creating a mini board or a supervisory board to do different locations. I have noticed in some counties, they talked about an annual application. Things don't always seem to happen once a year. The quarterly evaluation and aspect, I think, would be more beneficial for those of us that are boots on the ground working through some of these things. Stuff populates at different times. And if something pops up, it'd be nice to be able to approach an advisory board or sit on that advisory board more than just once a year.
Agree. So far, the Recovery Center and New Opportunities are the two that have reached out to us. I was happy with Maggie coming today, sharing best practices. And I think we have around 300,000 so far that we've received that has been in CDs for the last 14 months. So I think before, let's say, the end of June, 1st of July, we can start figuring out which direction and how to start dispersing them.
But I think people need to remember that this is something that's not gonna be a sustainable
Absolutely.
program, because we don't know how long these funds are gonna come. I know there's some coming over 10 years. I'm not sure how much that is gonna be, because I think
Yep.
the biggest chunk has been paid now, my
And I
understanding.
think we've got a little over 300, and I think I saw a projection at one time Carroll County was gonna get 464,000. I don't know why that sticks in mind.
I think
And
most,
they're still doing stuff, yeah.
Yep.
So,
I think
most-
people also need to understand these are not tax dollars. These are from
Yes.
lawsuits against the.
I think myself and New Op also understand that anything that we implement, yes, we have to build into our budget and go on that. We're currently working on adding a peer support specialist, peer recovery specialist, somebody that's been through those things to be able to offer support in our treatment center. I know New Op is also working on the same thing. So lots of options and lots of details out there. I think once we know a little bit more exactly what the direction Carroll County wants to go, we could be able to give exact numbers or help guide those directions.
So let me ask you this, you're talking about with the children, and then also the treatment.
Mhm.
Where would you think the most bang for your buck would be? Is it the treatment or prevention? Cause I think we gotta be careful what we use it for treatment. I think if some were needed with insurance, I can understand that. I also understand that we could probably utilize some of this for first responders for training.
Mhm.
And I don't think that'd be a bad idea. We put some of that money for them have the ambulance take care of that.
The hard part is if you start getting in, looking at putting people through treatment, how do you pick and choose? Who makes that cut? Cause at $30,000-$40,000.
Well, once it's gone, it's gone, you know.
But in my opinion, that's not the answer. I just don't feel that that's just not the answer because that's picking who gets help and who doesn't.
Well, they can split it up. They give
Prevention.
Grants on, you know,
You could do it that way too.
they could provide a grant to these people.
Yeah.
So it'll be up to them.
Definitely an application process as a team.
Yeah, I
Um,
mean,
I don't think I can answer that question appropriately. I think there's benefits in both sides of it. Depending on how that is presented, but I do think a whole group approach.
well, my point is I don't want to do too much overlap.
I think. I think if we get the people providing those services in one group and one comparison, you could prevent the overlap and make sure that we're all working on the same page versus doing the same thing in the same place.
I think that's what we would have to do, make sure that,
And that way. That would prevent that overlap and waste of money.
Thank you again for coming.
Thank you guys, and I.
Yeah, thank you very much.
Be absolutely available for any.
We will be
questions.
acting this time instead of just idea gathering, like last time was more of a workshop.
And we're available for whatever is need be to go from there. Thank you
Thank you.
guys. Have a great
Thank
day.
you very much.
Item number 13, Carroll County Employee Health Insurance Fiscal Year 26 stop loss amount decision. Courtney, if you want to explain this.
Well, you know, all the email I got from Clark. We got our final rates and they left the stop loss at 50, which is where we've been for years. They did give us 3 other options for stop loss. So 60, 75, and $100,000. I did some math and there'd be about a $65 savings going to 60, $134, going to 75, about 204 going to 100. Just with the
How much was 100?
204. I did a little bit of review on it and, you know, our premium didn't really go up this year. So I don't know if this is the year that you decide to.
It hasn't really gone up the last 2 years.
No.
actually probably longer than that.
Okay.
So I'm not sure if now's the time to increase it when we're looking at level cost or. But it's not my decision to make, so.
So- If we were to next year get an increase, and then if we were to raise it to 60,000 or 75,000, that could almost offset that increase is where you're kind of headed.
Possibly.
Yeah.
I think. And the thing that concerns me is, you know. You go to 100, that's double. And if you have 5 people that meet that.
Can you say how many in the last couple of years have exceeded the 50,000? Clark probably told us. I've got it.
He did tell us, yeah, I don't remember.
A ton,
There's only a couple of people, if I remember right, wasn't it?
I think so.
been years where there's been a dozen, you know, but now $50,000. Doesn't go very far.
Yeah, it's easy to add up to
You
that.
know, I mean, have minor surgery.
Mhm. Mhm.
And he needs to know this before July 1.
Well, he needs to know shortly, definitely before July.
What is this credit in here, that red thing?
We're supposed to remove that. They didn't.
Okay,
Cause I asked the same thing, I'm like, what is that? Cause it's not on the final rates.
I wonder why I get confused.
So I took that out of the equation when I was trying to calculate.
Wondered the same thing.
Well, I'm glad I'm not the only
Yeah.
one.
You're not colorblind, at least.
I
Jean.
mean, me to make the decision, and I wanted to increase the stop loss just to save a little bit of money in our employee fund, I might look at the 60. That'd be a small increase. You can see where we can do, from there, do about a $55 savings.
Per person.
Per person.
You know, I kind of tend to agree with you. I mean, we've been running over that stop loss, and this might be a way to spearhead some of that, top it off. I don't think I'm gonna go that full board.
What would 75 do?
What'd you say, 75? What was the difference between 60 and,
$134 is 75.
and what was it, 60?
60 was 65,
So you're double.
just in that 15,000 more.
Mhm.
As of the end of March, we had about $1.4 million in that employee health insurance.
We are sitting so healthy on
It's a
that.
very healthy.
Yeah.
Our goal always was to get it over 1 million. That's what we wanted to have, and we finally got it there.
800 to 900.
So what's stop loss? Explain it to me again a little bit. So if we go over. Sure.
Sure. Go in, have a surgery, and the surgery comes out at $75,000. Well, the county's self-funded, so we pay all of our own claims up to $50,000. The remaining 25, the insurance will take care of. So that's.
So you'd pay the 75, if it's more than that, then the insurance company pays the
It's
difference.
kind of like deductible in your car.
Gotcha, but the county pays for the deductible.
We pay up
Yes.
to the first.
That's what I meant, the first 50,000, then our insurance company
It's
pays the
very
other.
simple.
Yep, so so what it says is that
But like on
Now-
your auto, if you want $1,000 deductible, you get a cheaper premium.
if we stand at 50, we don't have any claims, so our insurance stays lower, but if the insurance starts having to pay a claim, it's a claim, so your insurance is gonna go.
Comes out.
Correct.
Cool.
We could
It's-
argue that if we had 100 people that all had $40,000 claims, we would pay all that year.
Yep, yep.
So. Just. maybe
Okay,
we'll stick
thank you.
with
That makes sense. I'm just curious how
Yeah,
that
it's-
works.
It's kind of a
It's a
catch,
number
it's a
thing.
catch 22 though, yeah.
Yeah, we got,
But-
I'm not opposed to moving it up to 60, but I'm okay where it is also, so.
The only thing I fear is I think we're kind of grandfathered, and I don't know that they even offer the 50 anymore. So I don't know if we can go backwards. But
Leave
going
it.
from 50 to 60 is a pretty small jump, and there are still savings there.
The savings is $65.
For 120 employees. Well, I guess I don't know if all 120 are on the insurance plan, but
It's all members.
okay, sorry, members.
So, when you look at they base the
I think
fees, and then they
$7,800.
choose suggested rates. So that administrative cost kind of in the middle of the page is where you see your savings. The claims don't really change. down
so
there.
65, 120, $7,800. I don't think you move it.
You don't think we should move it?
No,
For $7,800.
$7,800, but that's then it's 10,000 per instance. You know what I mean?
Mm-hmm. Mm-hmm.
So one instance is more than,
Good point.
Yeah, it's a guess.
It is, it's a prediction.
if you have
Yeah.
one person use it, you didn't save $1. I say leave it at 50 is my suggestion.
I'm fine with that. But I like her analogy.
I like having 1.4 million, knowing that we have that. That healthy of a, I don't want to call it a reserve, but a balance.
Well, it's a pool.
But if the
Yeah.
insurance would go up, we could take some of that away.
We could then up at 60 and not pass, and then the county portion and the employee portion could remain
It
the
goes up,
same.
okay, and then, but your next year, insurance rates could go up then, yeah.
That money that's in that insurance fund is actually taxpayer. Because
It's the
county-
85%.
The county pays 85% of the premium, so. I would think if that fund looks as good as it does when we do budget next year, that you might want to look at. maybe if they come back and they say, you guys are awesome, your health insurance is flat, maybe look at lowering. Because that could save, that'll save on the tax side too.
Well, we haven't been following suggested rates forever.
We're way below what they are suggested.
I think he said we were one of 11 counties that he had that had good news this year.
So I mean, that could change.
Yeah.
Yeah, we've been very clear about
A
that.
couple
and
of illnesses,
transparent,
yeah,
that
exactly.
Within
None of
in
us
one
getting
year, that
younger.
can
Well, I think
change.
it's been like 3 to 4 years. We've been like at 2% or under.
Since
That's unusual.
Yeah.
It's very good.
I would be in favor of leaving it at 60
And none of us are getting younger. 50.
Yeah,
or 50.
good point. You're right.
I'm looking at somebody.
Yeah. Two old guys.
So I don't think there was supposed to be action on that today, Courtney, was there? Was this a discussion?
Because I'm authorized to sign these rates and I didn't feel comfortable making that decision, so.
It does say decision though, so I suppose that we should do a motion and do a vote on it.
I'd make a motion to leave it at $50,000.
$50,000.
Excuse me,
stop loss.
sorry. $50,000 stop loss.
Is there a second?
I'll second it.
There's a motion and a second to keep the stop loss at $50,000 where it has been for several years. Any more discussion amongst the board? Not all in favor? Aye.
Aye.
Opposed? Motion carries.
Hopefully I would have done it for you.
So we did manure management's committee reports
I do need to back up real quick. I do have a safety committee this week as well. Thank you.
and Stephanie has done hers and
I haven't done
I'll
mine.
go next, or last week I had newspaper radio and I have nothing else on the agenda.
I can go. Last week, Monday, I did contact Manning and New Op about their presentations. And again, New Op will be next week. Tuesday, we had our executive meeting at the recycling center. Dalton got quotes, which will be brought up tomorrow at the safety meeting, but for the badge system to get into the offices upstairs. Well, I think there's 26 of them in the courthouse, 26 stores. Tomorrow at noon, last week, I'm sorry. Was Pig Easy from Templeton presentation at CCGP. That's kind of a cool company that ships worldwide out of Templeton, Iowa. I did go to the town hall at the Armory for the 1st Battalion of the 168th Infantry for families, employers, and community leaders. May 28th is our departure, and that does affect at least one county employee. Wednesday, I talked with Maggie about best practices on opioid funds. Thursday, I completed the Carroll County Stakeholder Community Needs Assessment for new opportunities. I think we all got a thing from Val Holsworth on that, and it does take about 11 minutes. I also went out to secondary roads and looked at claims. We had Region 12 Policy Council, 3 of us in here. Friday, courthouse payable. This week, today, Region 12, one of their open houses is at 204 West 11th from 4 to 5. Tonight's Carroll City Council. Tomorrow, 10 o'clock, safety meeting in the assessor's vault. And Friday, we have a meeting with CCGP on Access DC.
Last week had the Region 12 Policy Council meeting, very, very informal. And then Friday, Zach Anderson and I did a kind of a county tour. We got through about half the facilities in the county. We'll finish it up another time. Very interesting, all the things we do. We did meet with constituent on a Level B road, which was very informal too. Good work by Zach to explain what those kind of entail, what we need to do there. So Zach did a very nice job with that. Today, open house at Region 12 open house on renovation. Tomorrow, we've got a safety meeting. And then Wednesday, I've got a DCAT meeting. That's all I have for now.
Any comments from those in attendance? Courtney, next week. How many departments have you heard from? I know roads. Conservation.
Some that need some corrections, that they collected a little more revenues and they have some more expense to offset. So I've heard from almost everybody.
So no big surprises then. Secondary roads will be a huge number, but it's because of the season. Yeah.
Budgeted as an expense at some point.
Yep.
Not this year. Nothing.
Okay.
Hopefully we'll have the chair.
All right, I will entertain a motion to adjourn. Motion second, all in favor, aye?
Aye.
Opposed? We are adjourned. Gene, you made it out of here on 10 or 9:45 on the money. Sorry about that.
Got you.